I'm Dr. Jens Körner. I'm board certified at the American College of Veterinary Sports Medicine and Rehabilitation, and I'm located in the northern part of Germany, right in the middle of the Hanoverian breeding area. We have a larger equine clinic up there doing about 2,000 surgical procedures per year, and we are basically three partners focused on ophthalmology, upper airway surgery and orthopedics. I'm basically the leader of the orthopedic department, doing especially lameness examinations and purchase exams in that area. So we did a study with a BEMER Horse-Set in a surgical setting because we wanted to know if the horse-set is affecting general anesthesia in horses. For that purpose, we took a uniform surgical procedure. In our case, we used the vitrectomy surgery, which is done for equine recurrent uveitis cases, and we have a very standardized setting there with a very deep anesthesia and 1 hour approach, and we have many of these cases, about 1,000 per year. So we had 2 sets. We did a double-blinded study with 2 sets of BEMER blankets, and we applied these blankets to the horses in surgery. We just had 1 blanket underneath the horses in general recurrent anesthesia and 1 blanket on top of it. And we activated the blankets with the first cut for 15 minutes. And we didn't know which horse set was functional or non-functional. We had horse set number 2 and horse set number 1. And then we compared blood values and recovery in these horses and applied statistical methods to them. We measured CK, blood gas, and recovery. We looked for that in an approach by Donaldson. We used that for comparison of halothane and isoflurane anesthesia in horses. We found out that in our approach, like application of 15 minutes in these horses, in a 1 hour approach, in a 1 hour surgical procedure, was not affecting the blood values statistically significant. We saw a trend that we have had lower lactate values and lower blood pressures, but we couldn't support that with statistical measures. But on the other hand, when we look at recovery, we had seriously higher scores there at the scoring system by Donaldson in recovery with these horses. And that has been observed in other studies as well. We've applied that to 100 horses in total. So we had 50 horses with a sharp unit, let's tell it like that, and 50 horses with a non-functional unit, and we saw a significant difference. And our anesthetic team, they had, after a while, they had a feeling for that which set would be functional and which would not be functional, without knowing which one it would be. On that side, we don't really know what the horse set is doing, but at least it affects not the surgical procedure, but the recovery phase and the anesthesia itself. And we account that to a better blood supply to the peripheral tissues and to a better uptake of the anesthetic we used. And therefore another study or more research has to be done to utilize that for other surgical procedures, maybe to decrease drug delivery through surgery, to have a better influx of these medication into the horse during surgery. And we have to find out how to utilize this matter. What I think about the BEMER technology is basically we see with the clients, we have tons of clients who apply BEMER blankets to their horses, and the horses do relax underneath. We have support by our clinical study that the BEMER blanket is doing something for the relaxation of the horse. And so for every kind of disease like back pain, orthopedic issue, which is referred to something else, it might be beneficial, or it is, in my consideration, it is beneficial for healing. Definitely. Yeah.